Hello, everyone. You're welcome back again to our episode on our mental health series, where we dive into issues that is affecting our body, our mind, and our well-being. And today, guess what? We are looking at one of the most topical issues that is affecting millions of life, from children to the youth to the adult to the aged. Have you heard about obesity before? Is any of your family members suffering from obesity? Or perhaps have you seen an obese person before? You might be wondering what actually causes obesity. Obesity is on the rise now. It's one of the prevalent issues that is affecting millions of life globally. And in this episode, we are here to address it. Joining me today has always been our lecturer, our clinical psychologist and neuropsychologist at the University of Cape Coast, in the person of Dr. Daniel Mienza. Doc, you're welcome again to this episode.
Thank you for having me, Humphrey.
Okay, so Doc, in our current generation or century now, there are a lot of lifestyle that many individuals in the world are living. And there is this topical issue that is on the rise. That is the issue of obesity. It's been one of the problems that is indirectly affecting and leading a lot of people into their graveyard. So for many viewers out there, they might have a different misconception or issue or the idea of what an obese patient is or what is obesity. So as a psychologist, as a practitioner one, can you explain to us what is obesity? When we talk about obesity, what is it from your perspective to a layman's understanding?
Well, pretty much when we talk about obesity, we are talking about excessive weight gain, gaining the weight that is not suited to your height and age, pretty much. Right? For the age that you are in and the height that you are in, you need to get a certain weight threshold. Of course, the world standard has brought many thresholds.
Wow.
We won't want to go into thresholds.
Yeah,
When you are gaining excess weight, you know it,
okay.
right? When you are gaining too much weight than your body needs, you know it. You can see it from your movement. You struggle to move. You can see it from the clothes that you are wearing. See that you can't wear your old clothes again. So you don't really need anybody to give you standards, for you to say that I hit this number to show that you are overweight or you're obese. The mere fact that you are not able to wear your old clothes, the mere fact that you struggle to move, you suffer when you move, you see that you are struggling when you have to walk, should let you know that you are becoming overweight or gaining excessive unwanted weight.
Wow.
And that is what we want to say obesity is.
Wow.
Or gaining excessive weight. That's all we are talking about.
Wow. But Doc, per your explanation, I want to know, sometimes humans, one of the principle about human growth and development is such that, as we grow,
Right.
there is an increase in our body weight, height, and all those things.
Right.
So definitely, for example, with me, as I'm growing, there are certain clothes that I used to wear in my childhood.
Right.
It might not fit me.
Right.
So does it mean that at that stage I'm obese?
No, I mean,
Okay.
that is why they put obesity down to the age you are in,
The age,
your height,
the age.
and the weight you should have.
Okay.
At most, what you should have for that
Right.
body, your age, and also your height.
Your height.
So they look at your height, they measure it, what they call body mass index.
That's true.
They calculate it based on your height and also your age.
Okay.
So the age and the height that you have will determine what the threshold should be for you to say that you are overweight.
Okay.
So it's not a question of the fact that you are growing from childhood. Of course, we've left our younger days.
Exactly.
It does not necessarily mean that you are becoming obese. But the idea that you are getting excess weight, in as much as there are standards which look at your height and weight, all I'm saying is that when anybody is getting excess weight, you realize it yourself.
Okay.
Right?
Okay.
You see that no, you are not who you used to be. You can't wear clothes that you are supposed to be able to wear them, but you see that your stomach is popping up, right? You are gaining much, but also whatever you want to call it. Your thighs are becoming bigger, your leg is becoming bigger, your head is becoming much more bigger.
Yeah.
Face is becoming too puffy. All this increase in body weight, this is so visible for you to see. that you are gaining excess weight.
Wow.
Right?
Mhm.
We know normally how you should develop. You know that if your body is developing normally, you know. But if you are gaining, right, you will see that maybe even people that you are the same age with, you see that only you are like that.
Wow.
So you don't need an international standard for you to know that you are becoming obese or you are gaining excess weight. It's so easy, even when you look at your age group, the average body type that they should have. You see that yours is just way over, right?
Yeah.
When your stomach is becoming like that, pot belly.
Wow.
Now we have little children who have pot belly. Interesting. Adolescents who have pot belly. Pot belly used to be a thing for older people, right?
It's true.
Very old
Yeah,
men.
that's true.
Now,
Yeah.
women are getting pot belly, right? And then young adolescents and they are getting pot. Even very young children, you see that they have pot bellies. These are excess weight. You can see it in your body that you are gaining.
Okay.
And that is exactly the point that we are making here.
Okay.
You are gaining excessive, unwanted weight.
I like that definition, excessive, unwanted weight. So not a weight that should be typical to your age, but yet it has accumulated in you. So Doc, let's find out. Perhaps, there are a lot of issues now that people right now are obese, but they themselves, they are not aware that they are obese. They think that is a normal, growth and development thing that is applying to them. So though, we want to know, obesity is becoming more prevalent in the world now. Yes. So what are some of the causes? Can you expatiate on the causes to obesity?
Well, before we even get into the issue of what Brent said and what can be done to ensure that the epidemic that the whole world is struggling with when it comes to excessive weight gain, obesity, that the world is struggling with, is to look at the effects of becoming obese or the effects of gaining excessive unwanted weight. So many effects. It's a huge risk factor for type 2 diabetes. No wonder type 2 diabetes is a huge issue for many people, because we are gaining the body weight that we don't need, right? There are so many diseases, even depression. You can become more depressed when you have excessive weight. You can have sleep challenges, of course. Some people go to bed at night, they struggle to sleep because they are gaining too much weight.
Okay.
Your body will not have the adequate sleep if your body gains too much excessive weight.
Wow.
So the risk of it are many. Even it's a huge risk factor for stroke, actually, when you gain excessive weight, when you become obese. Cancer, some cancers, the fact that you are gaining excessive weight can put you at risk for certain cancers. So, and also its effect on your mental health. Gaining excessive weight can also lead you to stress, to anxiety, to depression, and so on and so forth. So it has both an effect on your mental and your physical health.
I see.
So now, to our main discussion about what causes it and what can people do, right? We'll talk about the first thing, and then we are saying that people are now getting addicted to certain behaviors, which is leading them into obesity. Let's talk about video game addiction.
Video game.
Among the adolescents and also young adults in the university. Many young guys, many younger people are now playing video games. They will sit down for hours playing with these video games. The more you sit, the more weight you gain. The more you move, the less weight you gain. Right?
Yeah.
So the video gaming is actually leading to sedentary behavior, making them sit for longer hours, which is actually leading them into obesity. For such people, all they need to do is to cut down on their video game playing time to avoid the addiction, which makes them sit longer hours, and therefore they will have a better weight, or they have a reduction in their weight. Sometimes people don't really need to go to the gym to say they are going to get exercise before they can lose weight. All they need is to check a behavior that they are engaging in, make a change in that behavior, the body has to start reducing. For sure. For video game addicts. You get the point we are making. And that brings us to our next point when we talk about sedentary behavior. In your own estimation, what do you think sedentary behavior would do? Do you think it will make people gain weight?
Yeah, definitely it will make people gain weight. I remember a time when I was working, and I realized that most of the I had a lot of tasks to do. So I was always glued to my laptop and then to my working tasks. And it came to a time I realized that myself, I was bloated. Yeah, people were telling me that, hey, Humphrey, I'm gaining weight. I thought it was a good thing because I was living, I mean, people would think that, yeah, you're living a good life. That's all what we think. That, when you put on weight in the Akan language, hey, why you can see you? Hey, so, Sikana Bao. That kind of, phrase. But I'm just realizing that that was more of the sedentary lifestyle to me. That was making me gain weight.
So pretty much when we are talking about sedentary lifestyle, we're talking about a life of inactivity, a life of sitting for longer hours. That is when we say that you are engaging in sedentary behavior or a sedentary lifestyle. And it's also a huge thing in this time.
Wow.
People who sit in offices, those of us who work in offices,
That's true.
Students who now want to always pick cars,
Okay.
sit at lectures for long hours,
Okay.
right?
Yeah.
Sit down to study many hours,
That's true.
right?
That is very true.
And so on and so forth. So that should tell you that we are becoming more sedentary. And that is why there's a lot of people gaining excessive weight or becoming too obese, because the human body, as far as we understand, is designed to move, to engage in the behavior of movement. The more you move, the more the body tries, the more the body is able to burn.
That's true.
All this excess calories and all of that, and therefore you have a better body weight. But unfortunately, we've created a life or a world where we are more sedentary, where we are engaging in a life of inactivity or sitting for longer hours, sedentary behavior. So if we want to end the epidemic, all we have to do is to look into our various life routines and cut down on our sedentary lifestyle or behavior.
Wow.
The office person has to now go out and take some walks,
Okay.
take some breaks and go and walk. Right. So students who sit down and study for longer hours will now have to pause at some point and then take some walks.
Oh, okay.
Those who like to sit down for longer hours, whether playing video games, whether watching television, will now have to make a routine in their life where they will get up and walk or do some running or exercise or something. So we need to find a way, each and every one of us, we need to find a way to introduce activity into our lives, as opposed to a life of inactivity, sitting for longer hours.
Okay.
That would be the way out to deal with the obesity epidemic.
Okay.
Right? So we can move to our next point.
Okay, so Doc, let's look at food. Is food one of the greatest, or let me say, is one of the contributing factor for people gaining?
Of course, because there are a lot of studies saying that the calories that we get from food, the more you eat, the more calories you put in, and the more you gain weight, right? Because like we said about sedentary behavior, as we eat, we're supposed to do a lot of movement so that the body can burn all these calories that we get from the food.
That's true.
But unfortunately for us, we are living a sedentary lifestyle in this era. So the more we eat, more calories in our body, we never do any movement to burn these calories.
Okay.
That is how come many of us are gaining weight. Right? So what it means is that we are eating more, of course, in this time, the concept that has come, we call food addiction. Many people are getting addicted to eating. Instead of eating maybe the 3-time meal that we know, we end up eating more than the 3 times. Right? So someone will eat in the morning, afternoon, evening, but in between they have a lot of meals. Someone is eating, they put their hand, they eat some. They will not count that as part of their meals for the day. They bought some snack they took, they will not count it.
Wow.
Or they took some small food. So a whole lot of other things. So before you realize, you are eating like 10 times in a day.
Wow. So Doc, what about, I'm sure people really would want to take in more food because of maybe the tax or their work they are doing. It's very much engaging. So with that issue, is it okay for me, like if I'm much engaged in a job and it's still more food? Okay. Yeah, it's cheaper.
Is that what you mean?
Yes.
But the body is designed in a way that maximum three times of eating should be enough to do whatever work that you are doing. Morning, afternoon, evening is how the body is designed. So if you are saying that you are doing any work and for that matter you get to eat more and more, the body, the interesting thing is that the body doesn't really make use of extra food you give it.
Wow.
That is a key point that we all need to note.
Wow.
The fact that you are giving it too much food doesn't mean that it will use it. It will take that which it wants and leave the rest as waste product into your body. So that's really mean that the more you eat, you are doing yourself good, actually. because it will take what it needs for it to level, and then the rest become waste product in your body.
Wow.
Right? So it's not about the more for more work.
Wow.
Yes.
So basically, once you've reached your maximum peak in terms of energy usage,
Right.
that means that you have to take a rest.
Of course.
And it doesn't cost for more food for you to gain an energy.
Yes.
Yeah. So that means that if you are taking in more and more food because you want to gain energy to carry on your tasks, doc is telling us that that food you are taking is not making use in your body. It's rather being stored as a surplus. It's going waste. And that could lead to the obesity, doc, right?
Of course. Overeating can also actually disturb your digestive system.
Okay.
The more you eat, the more trouble you ask for your digestion. Because food has to be digested.
Okay.
Right?
Yes.
The more you eat, the more you're asking your body to digest the next food. You will strain your digestive system if you keep overeating. Right? So it means that we take the normal foods, morning, afternoon, evening should be fine. It doesn't mean too much is good for you.
Okay.
Right?
Okay.
Talking about eating, we would also talk about the time of day that people eat.
That's true.
Quite often our digestive metabolism and all of that are much more active during the day than in the evening or in the night.
Okay.
So for those who do late night eating, which is also on the rise, people, because of work, they'll say that I don't close from work early, I didn't come back from my class early, and because of that, it's an excuse to eat late.
Wow.
So eating late is also one of the huge factors, because what it means is that our body cannot or will not be more efficient in digesting food late at night compared to day. Meaning that you end up having a lot of undigested material in your system, which will become waste product and therefore give excess weight.
Wow.
Yes, late night eating.
Wow.
For sure.
And I believe that late night eating, it's more of a pattern for most students here on campus and even outside.
Even for most workers.
Most workers too. So doc, let's look at sleep.
Sleep.
Sleep. We know that sleep is good.
Yeah.
It's healthy for the body.
Right.
It's healthy for the mind.
Right.
It's healthy for the soul.
Right.
So doc, is sleep a causative agent to obesity?
Of course.
Wow.
We need sleep for the body to recover. We need sleep for the body to be able to deal with most of the waste product that we have in the body. Because when we sleep, the body works to get ready. In the morning, we are trying to take a lot of waste product from our body, because during sleep, the body works to put the body together in some way. So sleep is needed, for losing weight or for being able to make sure that the body can deal with all this waste product and get rid of them. The person who doesn't get the adequate amount of sleep, especially the night sleep, is in trouble, because there's a lot of studies saying that if you don't get adequate amount of sleep at night, between 7 to 8 hours, those people tend to gain weight.
Yeah.
Right? Why? Because when you don't sleep, you go under more stress. Stress will make you eat more. You get depressed. Depression will make you not move. So sleep will lead to other mental health things that will lead to excess weight gain.
Wow.
So
this is so insightful.
Many people do a lot of exercise when they want to lose weight.
Okay.
And rather, they don't really get adequate amount of sleep at night.
Okay. Yeah.
These people will struggle to lose weight for sure. Yes, because then doing exercise and not getting the adequate sleep at night will do you no good. You need sleep for sure.
That's true.
Yes.
That's true. So doc, let's look at the key things that as human beings, or let me say as people in this world, we can do to minimize or put away the issue of obesity. What are some of the habits that we can carry on, we can take, we can adopt?
Exercising.
Okay.
Regular exercise.
Okay.
The modern man doesn't like exercising.
That's true, though.
Right? Because of our activities that we engage in. So we need exercise for sure.
Exercise.
Regular exercise. If nothing at all, let's take some walks. Again, cutting down on late night eating is also a huge thing.
Wow.
Making sure we are getting the adequate amount of sleep, 7 to 8 hours at night.
Okay.
And also the idea of dealing with stress and depression. These two guys, mental health challenges that are on the rise. Almost everybody in the world ever goes through stress and depression. And there are also some of the reasons why people are gaining too much weight. Stress will make the body release chemicals that will make you gain more weight. Depression will make you not want to go out and do anything, meaning that depression will make you become more sedentary, or be someone who will lock yourself up in the room because you have a lower mood, you are not happy in life, you wouldn't want to do any movement, you wouldn't want to go anywhere. Okay. So that is how depression and stress can lead to excessive weight gain. So one way people can deal with obesity or excessive weight gain is that they need to find ways to deal with depression and anxiety. And that is one of them.
Wow. There are certain food that when we eat, there might be a causative, agents to obesity. And in Ghana, most of our dietary food is carbohydrate. So, Doc, we know that carbohydrate, the end product, is glucose.
It's glucose, of course.
And sugar, that is contributing to a lot of, fats. And so speak on that. So in the Ghanaian culture, yes.
Go on, you go on.
Yeah, so in a Ghanaian culture, I know you're not a dietitian, but as a clinical psychologist, what could you recommend for Ghanaians?
I'm not a dietitian, like you rightly said, but we deal with behavior, and eating is behavior. So the type of foods that we eat, of course, excessive intake of carbohydrates, is definitely an issue because, like you rightly noted, end product of carbohydrate in your body is glucose. So you see how our women, the way we get body and all of that, because of our diet, of course. What it means is that we need to cut down on excessive carbohydrate intake if we want to be able to control our body weight. And let's not forget that gaining excessive weight or obesity is actually a risk factor for many of the high blood pressure cases that we see.
Okay.
Excessive weight gain. Yes. So no wonder we have high blood pressure being an epidemic too. Okay, because people are gaining the weight that is more than their height and also the age that they find themselves in. So cutting down on excessive carbohydrate will help to reduce weight and therefore prevent high blood.
So Doc, let's look at gender. I don't know, there is a misconception that surrounds that, females are more prone to being obese than males. Is there a fact?
I read somewhere that that women have fat cells that that store a lot of fats than men. So no wonder they gain body weight more than men. But again, women are also having a lower risk for high blood pressure and co than men because they are gaining weight, especially on their buttocks or maybe their thighs. These are areas that does not really disturb the body much. In men, we tend to be at risk because quite often we tend to gain our weight at the abdominal area or the stomach area, right? Yeah. Which is where most of our important organs are, meaning that there'll be a lot of fats lying on top of the organs, your kidney, your liver, all these good organs that help us. That is why men tend to be at risk of high blood pressure than women because we are gaining the weight more often at the abdominal area. Women get it usually at the back.
Wow. Yeah. I see. So Doc, let's look at this. When obesity sets inside, I know there are a lot of side effects and there are a lot of problems that obesity can lead to. Is obesity one of the risk, factors to death or to premature deaths?
Well, the leaner you are, at least from research we know, less body weight, or being obese or overweight, you increase your risk of death. Yeah, because people who become obese or gain excessive weight are more likely to die than people who don't gain those excessive weight. Okay. Because being obese or gaining excessive weight is a risk factor for heart disease, including high blood pressure, right? And also it's a risk factor for type 2 diabetes. It's a risk factor for stroke. It's a risk factor for mental health issues like stress, depression, anxiety, and so on and so forth. So it puts you at risk of many other diseases. That is why becoming obese or gaining excess weight makes it more likely the person would die.
Interesting. So you've heard from Dr. Mienza that obesity is one of the risk factors to death. So that means that we have to be very mindful about what goes inside our body, our lifestyle. Are you the kind of person who sleeps a lot? Are you the kind of person who works without exercise and eating all the time? Then you have to check your lifestyle. So now, what is this precious golden advice you want to give to viewers out there as a take home? to help them in terms of their healthy living?
The advice, my final advice would be for men, because men, we are those who are involved in excessive alcohol intake and excessive smoking. These two guys put us at risk of becoming obese.
I see.
Or gaining excess weight in the body.
Wow.
So cutting down on smoking, cutting down on excessive alcohol intake will help us not to become obese and therefore be more healthier and therefore live a longer life.
Wow. Therefore, be more healthier and live a healthier life. Well, thank you for joining me on the set, and we'll see you in our next episode with the same guest, Dr. Daniel Nyenza. See you.